And I love that you say that too, because I talk all the time, what's success? And success is lowering dose of PD5 inhibitors, getting all tribe mix, or even getting up PD5 inhibitors. But they also understand like improvement and success too. I tell people all the time, I'm not the first option. Usually I'm the 14th. They're doing some calling, they're digging, they're searching to find a doctor that, is not gonna give a penile implant. That guy I told you about, he came back 3 times. And the reason why, he says, I kept getting results. I did it once, and I got more results next time, and third time even more. So he says, I didn't lose anything. I just kept improving. And look at the women now. I saw Holly Berry talking about, taking testosterone. Like, it's everywhere now. But 10 years ago, that wasn't a thing.
Welcome back to the RevMD podcast with me, your host, Dr. Debra Durst. Today, we're getting into some good stuff. I have a special guest on, and we're going to talk about erections and ED and how to improve your sex life. So say hello, Dr. Ken Haywood. We met in Vegas. We got to tell the story, but welcome. Tell our listeners a little bit about yourself.
Hi, so I'm Dr. Kendrick Haywood, and I am the former medical director, chief of Health Gains and Gainswave. And I am, worked with so many patients from all across the country in different countries, working with erectile dysfunction, coming with Shockwave protocols, general medicine, peptides, and helping men from, 20 to 70s, even 80s years of age to perform sexually.
And it's interesting because we were sitting in Vegas at the anti-aging conference. And again, very little on sex with that conference, right? Biggest anti-aging conference, but very little on sex, men or women. And then we're sitting next to each other at a lunch. And we had both been following each other on social media, knew all the same, people. And again, I don't know if they understand when you say health gains that like you were really there when the acoustic shockwave wave started here.
That's right. That's right.
You were on the ground level of that. So
absolutely,
tell us a little bit about that.
One thing I think what Health Gains brought is they brought the popularity of the acoustic shockwave to the U.S., right? It really became a dominant force in, the Gainswave of getting, thousands of providers, shockwave training and educating people on acoustic shockwave. So it became like, something that's very unfamiliar to people to something that's, all across 50 states, people are requesting shockwave treatment. Chiropractors doing it, MPs, PAs, everyone's doing it now.
And it was it was being used internationally.
It was
more than it was here at that time. But this was like almost the entry into the US for the treatment because I had not heard of it before.
No, definitely was not. And, I think when they put the YouTube video out, it hit the media, it went viral at that time. So, from, no one knowing what this was until everyone kind of wondering what it is, they really brought something that's very unknown to the U.S.
And I heard the story that it was, again, so you guys were doing just a lot of testosterone hormone, replacement, again, before it's time even for that.
That's right.
And then you guys kind of offered up like, a introductory trial of the acoustic shockwave to men coming in and out of the office. What a brilliant idea, right?
Right.
Yeah. So somebody wouldn't want to try that for harder erections.
Yeah, that's right. And men are trying stuff regardless. Like, we know that. They go to gas stations and they buy things, Rhino, and you can talk about all kinds of supplementation, even on Amazon. But people we know for sure in this industry are always trying to try something new for improving sexual performance.
Yeah. I love when I'm kind of at like a dinner party again. You and I just happen to be sitting next to each other and all this talk was just normal for us, right? But when you're at a dinner party and you bring up what you do and everyone's like, oh, I don't need that. Every guy. So you would probably pretty much say that every guy is BSing when he says that because what man wouldn't at least want to try something?
That's right.
Yeah.
Yeah. I think it's a problem.
Anything.
Yeah, I think it's a problem for the men because, most people think they should come to me when they have a problem. And they should definitely think about that. Otherwise, you should come visit a shockwave or somebody who does erectile dysfunction, even if your performance decline a little bit. So you can be in your 20s and 30s and still get great results with it, not even having a problem with like erectile dysfunction yet.
Yeah. Have you seen, because I get a lot of those younger ones that
Hmm.
actually probably want more than anything size. Like it seems
Hmm.
to me like they are under the understanding that you get a little bit of size increase when you're doing the
Hmm.
gains wave. And of course they get better function, but they all seem to be happy. We don't advertise that, but
Hmm.
and for older guys, I feel like they just get their erections back and therefore you get the
Hmm.
size that maybe you didn't have for a little while. But
Hmm.
with men, do you
Right.
think that tends to be one of the big reasons why they come in
They
is for
do.
a P shot early on?
Yes, they do come in for the office. You get requests, requests about size going through. I don't promise anything, but I do hear from, the patients like, hey, my size improved with this treatment, right? I've definitely
Mm,
got more length than I had before in years. And, I told them that's expected. It definitely, if you lost some size due to poor blood flow, which can happen. But
mhm,
you don't realize, a lot of men don't even realize they lost size, right? It didn't come to their
mhm.
mind because they've been dealing with, the situation for a long time. And when they finally get treatment, they say, wow, I didn't realize, I lost a step or, I lost some size over time.
Yeah, no, it's
Yeah.
something that the function is more important
Mhm.
to them.
Yeah.
So what's your oldest patient that you've treated for
I,
erectile dysfunction
I
and
had a patient
hormones?
that was 84 years old. That was like my last one, I think. Other one I think was 88, but last one I remember was like 84 years old.
Okay. And was that patient on hormones,
Mhm.
or you had to do both? Because again, there's the hormone and the regeneration. So,
Yeah. Oh, the
w-
patient definitely was on hormones at that time.
okay, all
Yeah.
right. But then, did you get him rejuvenated and sexually active again?
Absolutely. And, the thing with that patient was he was on Trimix, and then, which was the prostaglandins, right? Which allow you to get ED and the injections in the penis. And then he got off the Trimix and he was able to perform sexually with Viagra Cialis again.
Wow. So like
Yeah.
a step down. And that's what I always
Hmm.
tell patients is like we try and
Yeah.
get you at least one better than you were.
That's
Hopefully
right.
all the way better, but at least one. Yeah, so he was down to just using the PD-5 inhibitors instead, huh?
And that was it. And, I love when you say that too, because I talk all the time, what's success? And success is lowering dose of PD-5 inhibitors, getting all
Mhm,
tribe mix, or even getting up PD-5 inhibitors. But they also
mhm.
understand like improvement and success too. Like I
Yes.
love you said that because you got to give guidelines to what to expect. Like, okay, this is success. You got off Viagra
Yeah,
Cialis, that's success. You need
yeah.
less Viagra. You need 5 milligrams Cialis from 20, that's success.
Yeah, exactly. It's not gonna be like, well,
Hmm.
again, it's not, I'm not gonna say it's not gonna be, but it
Hmm.
doesn't have to be that you're like you're 20 again.
Yeah,
But again,
yeah,
yes, I think that improvement,
yeah.
and definitely if you can get a man off injections.
Hmm.
But you and I were even talking about that. So
Hmm.
offerings in traditional medicine, pretty limited, right?
Very.
So, and you have had patients that they go from one extreme to the other
That's
when it
right.
comes down to ED. So what's your typical story when a guy comes in with erectile changes? What's the typical story they tell us, like from what they've heard from the urologist or the primary care?
So usually from the primary care, you know, once they get off Viagra, Cialis is no longer working. They refer to urology, right? And at that point, primary cares are usually doing only PD-5 inhibitors. Very few actually give testosterone. Like people think it's common. Not really. I don't see the primary care is really giving. Some do, giving testosterone for ED. But about time they go to a urologist, it can be very scary for a patient once they enter that office because you're going from taking pills, right, into maybe doing injections if the urologist is versed in it, or even
Mhm.
sometimes undergoing a surgical procedure, right? And that can
Mhm.
be very scary for a patient.
Yeah, a quick recommendation to a implant,
Hmm.
right?
Yeah.
And I think I wanted to just see if your, again, storyline for that patient was about the same. And I hear it too on a regular basis where
Hmm.
they're offered very little, right?
Yeah. Very little.
Um, very little. And that's why a lot of times with the perimenopause, menopause and the
Hmm.
women in sex,
Hmm.
and us discussing that more, a lot of women will feel like they've been so left behind. And I was like, I agree, you have, but men have too. So,
Yeah.
but men have too, like, and that's the part that we don't always think about because they see low T clinics. So they assume that like men are
Mm-hmm.
getting all the offerings.
Mm-mm.
But honestly, again, everywhere on the YouTube channel, we
Mm-hmm.
get, things such as like, do you have anyone that does this? And
Mm-hmm.
it could be New Jersey, it's in any state,
Yeah.
essentially.
I think men go into from a primary care to a urology. You're going from the most extreme condition from taking oral pills for sure, testosterone baby,
Mm-hmm.
and then you go into a surgical procedure where and it's not a light procedure. No, it's very intensive to get a penile implant. People think it's light, into a very highly invasive, procedure. As a trained doctors at health games, over 100 MDs giving class. And I told you all just always, I love them. They're my favorite people to teach. Y'all go from the least extreme, to the most extreme. Me and you, Dr. Durst, we're the in between. We all
Mm-hmm.
in between that aspect of going from the shot or pills into the penile implant. We all in between. And all those
Yeah.
patients they miss, we tend to get. Like I tell people all the time, I'm not the first option. Usually I'm the 14th. They're doing some calling, they're digging, they're searching to find a doctor that, is not gonna give a penile implant and can get them back. And believe it or not, I used to get patients that were older, 70, and they could not get the penile implant because I guess they can go undergo anesthesia. So you got guys that come off this 10 years of not having sex. And I got a lot of those guys back having sex again after man
Wow.
10 years. And even fell in trimix, fell in this.
Wow.
And that's where I think is where we at because me and you, where we live is Shockwave. We live into the region, which we got a whole topic for that one, you can imagine. But think about
Mm-hmm.
this. We get guys away from getting the implants into, maybe even Cialis again. That's working. Maybe using Viagra. That's working. A lot less
Yeah.
invasive.
Yeah, I mean, there's so many, and again, I always say there's no reason without like a nerve injury that
Mhm.
you can't get the function back. It just
Right?
depends on how many, treatments you might need because
Oh, yeah.
again, they didn't even know about it. So
Yeah.
if somebody comes in at 40 with mild changes versus 70 with more
Oh, yeah.
severe,
Yeah.
there's just more, that we have to do to get them
Yeah.
back to where they want to be. But as long as they want it, and they
Hmm.
haven't had a surgery that has interfered. But no, I agree. And there was a Peyronie's patient that sticks with me, and we did a
Hmm.
testimonial on him way back,
Hmm.
and it was his wife, and it was
Wow.
this old testimonial. It was like when I did it myself, like right after I opened, and
Hmm.
he was offered the same, like, so he was
Hmm.
at the implant. And he didn't want it. So we did
Hmm.
the PRP injections, the P shot, we did the acoustic
Hmm.
shockwave, and he had resolved.
Hmm.
And then his
That's
wife
right.
and he were sitting in front of us. And then she started to comment that it's not just about him, that it was starting to get painful for her, to have sex because of the curvature. And
Hmm.
so it's amazing. And he's like, and I just wasn't going under the knife. It's
Hmm.
like it wasn't an option for him.
Yeah.
And so, so that's huge because that's also something that isn't going to improve
Hmm.
without something, regenerative, like insignificant. So,
Hmm.
so basically, have you seen a lot of Peyronie's in practice too?
Oh yes, they had I think a third of the patients that did Shockwave did for Peyronie's. And
Okay,
that was
yeah.
like a big one, I remember. And it used to get complicated because even the Peyronie's patients who have ED, and then, and that, because that would make things tricky for the urology because they didn't want the patient that had
Mm,
ED Peyronie's, right? That was one thing I was looking with when they was using what was they using for the patients for the
The
Xiaflex,
Xiaflex.
right? Oh
Yeah.
man, I've
Yeah.
seen all kind of nightmares with that one. I saw somebody had a penile fracture, like going through, but
Mm-hmm.
they didn't want the Xiaflex, right, because of the ED patients, right? So they
Yeah.
would come to my office, and we working them. And, Peyronie's is like a whole different topic because the curvatures, there's quite a few different ones, that you see. So it's never the same. Anybody who dealt with Peyronie's, but I've seen some good cases if you catch it early enough and a soft enough nodule where you could change things. But then the hormones got to be right because people understand low testosterone can cause Peyronie's too, right? That's issue the
Mm-hmm.
injuries, right? But it gets so complicated with the shockwave of Peyronie's because you see
Mm-hmm.
different
No.
cases.
I
Yeah,
agree. It is tougher to treat for sure. But no,
yeah.
that's Xiaflex. We even looked at the studies way back.
Mhm.
Even the studies were were not good. Like
No.
the studies were not like if you had I think it was like I don't know, like a significant percent, I
Hmm.
don't remember the exact,
Hmm.
on patients that would actually have a fracture after. Like
Hmm.
that was enough to talk most men out of it. I
Yeah,
haven't seen a guy that's done Xiaflex in 7 years.
I haven't
None of
seen.
them. So,
It's been a while for me too. I'm over 4 years now, but I've never seen a guy so far even have good results with Xiaflex. You know,
yes, true.
right? I guess I
Yeah.
wasn't getting the cases. I don't know what that's about, but seriously, I haven't seen people that got the best results with Xiaflex. And that was very
Yes.
interesting too, because you see these guys coming in. But I remember one thing: the ED guys with the Peyronie's, they didn't want them, and that's one thing we kept seeing in the office all the time. And I've seen guys on Xiaflex, and I've seen also, imagine a bent penis from it, or they had, a fracture from it, which is, insane. But remember,
Mm-hmm.
it breaks down collagen, it collagenates, right?
Yeah.
That's how it really
Yeah.
works. But
Yeah. So it makes it even weaker.
that's right.
So now you not only have just a curvature, but you have that weakness and the
Hmm.
collagen there. Yeah.
Yeah.
So tell me about, tell listeners that maybe haven't had a pea shot about the pea shot,
I mean,
like
the peach.
what that's about.
I mean, pea shots probably one of the first regenerative medicine we was doing for ED, right? And that was
Mm-hmm.
platelet-rich plasma. So we take your plasma, we spin it around in centrifuge, and we're trying to get that buffy coat. What's the buffy coat? Buffy coat is where the PRP lives, right? It's that platelet-rich plasma. It's the platelet-poor plasma, but we're trying to get platelet-rich plasma. With the PRP, we're going to do an injection of penis, and what we're trying to do is we're trying to get your body to heal and repair itself, right?
Mm-hmm.
So let's say you're not getting the proper blood flow, then the PRP can be very helpful for like nerve damage, right? Blood flow issues to get your body to perform like it has. I always say try to get back 5 to 10 years as it used to be to heal and repair itself, right? But
Mm-hmm.
I think the PRP was always great, especially when you did the additives with it. So when I did my PRP or my injections with the men, I do a shockwave with it, right? And that's what, I was
Mm-hmm.
getting the best result because I was giving you those micro, fractures, right? Which, little micro trauma, which your body senses as, I'm in danger, help, and the PRP can help go into your body to, to heal and repair itself, especially the pro factors.
Mm-hmm. Yeah, and I actually will not do a pea shot without acoustic shockwave right
Mm-mm.
before it. I
Yeah.
won't do lasers on or I won't do no shot on women without a laser before either,
Hmm.
because you're really just
Hmm.
regenerating, like you're communicating with all of the tissue, and then you dump a
Hmm.
bunch of growth factors in there with the PRP. It is
Yeah.
just a win-win for everyone.
Yeah, because I feel like you give your body way more direction, especially when it goes in there and sees all that information. It's gonna try to go in here
Mm-hmm.
repair. But you're right, definitely want to do the shockwave or any kind of laser treatment. While you're doing a PRP, right? That's the best way, to get
Yeah.
results. Or even like the stem cell particles, exosomes,
Yes.
right?
So talk about that a little bit. So are you using still stem cells, or are you using exosomes for the most part?
I've been
I'm
using
using
exosomes
exosomes.
for like the
Yeah.
last 6 years, right? And
Yeah.
that's just really changed my practice. Stem cells were great, I did for 10 years, in this industry, but it was like they were hit or miss, right?
Mm-hmm.
I felt like once you got the right exosomes like protocol, the patient would definitely see a much more consistent result. So all those patients you hear about who's 84 in their 80s coming back, that was all exosomes. 100%,
Mm-hmm.
right? And
Oh
some of
yeah.
those patients that failed trimix, even the ones that had the radical, they had radiation treatment for prostate cancer, all the people that got recovery from those, conditions where they couldn't have no erections benefited from having exosomes.
Mm-hmm.
So with those
Yeah.
patients.
It's game changing.
Absolutely. Because we were
Yeah.
so limited with elderly patients for years, like couldn't do anything for them.
Yes. No, I
Yeah.
agree. Sometimes, again, if it's difficult, right? And so
Mhm.
those are the ones that you really have no choice but to
That's
throw
right.
something younger to regenerate.
Hmm.
They just don't have that platelet growth factor that you need,
Hmm.
right? So
No.
tell everyone what an exosome is.
So you gotta think of
Sorry.
stem cell. You gotta think about exosomes. Exosomes are like the vesicles that secrete from the stem cells, right? These are the cell messengers, right? So they can contain, protein, different things. But look at this as a cell signaling, right? We are on the peptides,
Mhm.
right? Peptides are what they do, cell signals. They tell your body to heal and repair itself. Like, so people talk about, oh, peptides are great. Well, exosomes are very similar to peptides. They access cell signals to your body to heal and repair itself. So let's say you have a elbow injury, right? Let's say you have a tennis elbow, that could be helpful. Regrowing hair, burn victim skin, and especially ED. But she's right. Like, that's where I think the expertise comes in, because like, you're right. Like, I talk about all the time. I had this patient that was 80 some years old. He says, only one Shockwave. I say, sir, I like you a lot, but I cannot give you 12 Shockwaves without getting Exosomes. Why? You're not gonna get results. I cannot honestly tell you you're gonna come back from that easy. Because think about the elderly. What patient will bump into things and bruise and not heal?
Yeah.
Have bruises for months.
Yeah.
Elderly.
Yeah.
So you cannot heal from a bump into a door. Older, right? So how are you going to heal from, a Shockwave treatment or improving your ED? You're not going to heal.
Yeah. Yeah. No, with age, that definitely declines.
Yeah.
And no, that's us. I always just say too, when I talk, because a lot of patients will come in and they'll be talking about stem cells or exosomes. So I basically am saying, like, again, we're just taking all the good stuff out of the stem cell. And now that's what we're giving you. And it's acellular too. So it does have a better potential viability as well. So
absolutely.
yeah.
Because, that's where it gets tricky too. Because, somebody says PRP, but we know PRP, that's age-based. Right? If I'm a 16-year-old, that's some great PRP, 25, 30. But the elderly, again, your body does not really have the capacity to heal itself. So that's why I think, the expertise coming in and all the years of practice, but what works for these patients. And that guy I told you about, he came back 3 times. And the reason why, he says, I kept getting results. I did it once, and I got more results next time, and third time even more. So he says, I didn't lose anything. I just kept improving. And that's what the main thing. He kept coming back because he was happy with the results and referred people.
Yeah. And I think that, like, there's no one thing that can make a bigger difference in your life. Like, if you look at markets and you look at health, wealth, relationships, this is health and relationships in one. And so, like, again, sometimes patients will spend more on like a car, a yard. I'm like, you only have one body, like, one relationship. That's like vitality, core vitality, right? And so, yeah, I would rather spend it nowhere else except for that.
How many
They all
marriages have
need
you
better
seen?
sex.
How many marriages have you seen people fighting because they're not having sex or they can't perform anymore?
Yeah.
And I've seen it from the men and the women on both sides of it.
So we did we have a No Man Left Behind campaign because we do. So Dr. Haywood and I see different percentages of, men and women. We have about 30% men, which is actually pretty high, all things considered, because for not being like strictly like, a male clinic. But you're about the opposite. You see more men.
It's a lot
And
of men.
so, but it's interesting because we have women come in super distressed, and obviously they've been left behind where they have no sex drive and they're tearful because it's hurting their relationship. And I'm like, well, we can get that back for you.
That's right.
But you may, like, your husband may have to see you after we get you optimized. And sure enough, they will end up in front of us. And so there was this going joke about No Man Left Behind. So when the first husband came in, and this was like 7 years ago, I'm like, that's it. I'm going to do the t-shirt, No Man Left Behind. And then like he sends one of his friends in, and that couple's sitting in front of me. And it was like, what else do you want to learn about when you're here? And he was like, what's this No Man Left Behind thing that I hear about? So it has kind of become a thing locally just because, again, they have to be on the same page, right?
Absolutely.
You got to have the sex drive matching.
Yeah, they have to match. Definitely.
They have to match. And one of the things that we can both do is we can optimize both if we need to, because hormones. So why do you think hormones for men have been so underutilized? You would think that the primary carers or the urologists would have caught up with this. Like, why do you feel like we're still not there?
I think a big part was the stigma, right? There was so much stigma, I think, in primary care in school to give, men testosterone and androgens, right? And don't get me started. I think the women, got shafted even longer because, when I was giving testosterone to women, let's say like 8 years ago, like say 2018, I still have men like, calling me. Like after, the encounter, you gave my wife testosterone. Say, sir, I gave, and I gave her a small amount. What'd you get? 10 milligrams. That's a small amount. Well, I said, okay. Hung up the phone. A week later, he calls me.
Th-
Dr. Haywood, thank you.
Thank you.
Yeah,
Yes.
I'm getting, hey, you got my wife back. Like, thank you. And
Yeah.
a lot of women telling me, Dr. Haywood, have you met me before? You say my first marriage. That's about time. And you too. We say my marriage is Dr. Phil
Yeah.
because the men had testosterone access, and the women haven't. And all these
Mhm.
women for 30 years were doing testosterone and progesterone. I mean, progesterone, estrogen from these clinics, from the old school guys, and they was even getting no testosterone. And that including with the black box warning they had that just got removed for the hormones, right?
20
But
years later, right?
right, but our generation, we're taking it. But our mother generation, no way. And
Yeah.
that's
Oh
funny. So
no.
our mothers, no, our children will, and our grandkids will, but we missed like a whole generation of women that could have benefited from this. And what got me was, what did we give the women? Antidepressants. What did we give women for the hot flashes and losing the libido? They're
Mhm.
depressed. But if I fight with my husband too, if I'm going through marital issues, I'll be depressed too.
Yeah.
Right.
Well, and even hysterectomies, like we can go even a step further than
Mm-hmm.
that. Like hysterectomies are done most frequently for
Mm-hmm.
something related to bleeding, or
Mm-hmm.
like even endometriosis is still an estrogen
Yeah.
effect. And yet we're taking out an end organ
Mm-hmm.
because of a hormone that needs to be corrected. And we're
Correct.
literally and then they can have sexual dysfunction because of it, because now
Yeah.
they're not making hormones, even if they leave an ovary,
Mm-hmm.
or, they don't have the same sensation.
Mm-hmm.
And then they get depressed, and anxiety and depression is high just from that alone. So we have done
Mm-hmm.
women no favors in medicine
No,
over
we
the
haven't.
last 20 years. No. And so I laugh because a lot of my patients
Mm-hmm.
will like come in, and the husband is like, when are you going to see my best friend? Because it's like 3 months out and she's due for blood
Mm-hmm.
work. It's like, when you going to see my best friend? I was like, I need to see some presents. Like at
Mm-hmm.
this point, like I'm everyone's best friend, but like I need to see some presents from it. So sure enough, they'll bring stuff around Christmas,
Mm-hmm.
like chocolate covered strawberries, because the men again are so happy to have their wife back and functioning. I've had a couple say, I haven't had two-a-days in years.
Mm-hmm.
And
That's
now they
right.
were having 2 days again. So
Mm-hmm.
it's great to hear, right?
Yeah.
And you
No,
have
it
the
definitely
opportunity
is.
to,
I say this work that we do is just like, those are the stories or like experiences that I feel are priceless. Helping out people who have marital issues, and then helping people out that had no hope with professional performance, especially these men, the old
mhm,
elderly men. But I follow those cases always be fulfilling. People say, you like what I do? Yes, I do, because, I'm kind of on fighting for, I have a running joke in my office. I have saved my marriages in Dr. Phil. I tell all my patients, like, we laugh at why? Because, like, you want counseling, or you really want to get down to the issues you have, right? But
yeah.
if you fight over sex and you're depressed and you feel like she don't want you, which is not true, then you should evaluate your hormones. Tell them all the time. You know,
Yeah. No, I agree. That's a great saying, though. I might have to adopt that one in the office
yeah,
and just say, maybe I'll come up with a slightly different version, but Dr. Phil, you can't top that one.
yeah,
And
and
we,
and look at the women now. I saw Holly Berry talking about taking
mm,
testosterone. Like it's everywhere now. But 10 years ago, that wasn't the thing. Like it was creams, right? And then it got to the pellets. Remember that? And then
mm-hmm,
no one's giving testosterone injection to women. I was doing it like 8 years ago, and now I see thousands of people I've treated, but now it's everywhere now, which is good to see. Like we definitely going up, but the
mm-hmm,
men, definitely was shafted with hormones, but women, oh yeah, they gave a whole slight. Like you shouldn't touch this. This for men only. But we had that conversation before in
mm-hmm,
Vegas. It's like you get those problems when you treat men like women and women like men. And that's where
mm-hmm.
I think you can see somebody that's expertise with, in this industry versus trying to do it yourself, right? That's going on right now, all the
Yeah.
peptides. People do it yourself. No, no, no. You should
No,
not
no.
take your man testosterone. He should not take yours.
No, you should definitely not be doing that. In fact, when it comes to sexual wellness, we treat men and women, and we do a ton of that. And again, obviously
Yeah.
more women, but still a significant portion of men for that. And we treat them differently. So
Mhm.
we were talking before about this, that
Mhm.
I don't do acoustic shockwave on women.
Mhm.
And a lot of people will kind of push that, but it's because that's the device they have for it, which is fine.
Mhm.
Great. But I have multiple lasers that can do vaginal
That's right.
rejuvenation, and I prefer that in women
Mhm.
for the effects that it can have. So why would I treat them,
Mhm.
like a man? I think acoustic shockwave is great for men, but
That's
I
right.
think that lasers are better for women. But they both need PRP and exosomes. So
Absolutely.
that part, yeah, they converge
Yeah.
again for that kind of treatment. But
Yeah.
yeah,
You're so right.
what I think that the other thing is I agree with you that we're talking more about tests,
Mhm.
but how much do you want to bet? Even though people are talking about it, it's still predominantly creams. I bet
Mhm.
you,
Yep.
because they're talking a little bit about it. But every time I get a woman, I would say that there's probably, 1 out of 100 are actually on a pellet or injectable.
That's
Most
right.
of them are still on creams. So
Mhm.
I think that even those performers, and
Mhm.
popular influencers are talking a little bit about it, but I think we're going to probably find out when they get down to the specifics. It's going to be creams.
I agree, and I think it's such a mindset too among providers because I've seen people that creams, and I'm saying you offer no injectable testosterone, we're only giving creams, but it's such I think a mindset like people have that shots are predominantly for men, right?
Yeah.
And I think that's where the education and the skill set comes in with us because we know
Yeah.
that you can do shots as a woman and still be a woman
Yes.
every day.
Yeah. Well, and yeah, you're not going to turn into a man.
You're not going to get one of
Yes.
these, right?
No, no.
No.
I actually have a couple slides like that where it has the
Hmm.
the woman with this big beard and hair
Hmm.
everywhere, and I was like, you're not going to turn into that
Hmm.
just because you have testosterone. It's like the
Yeah.
person that lifts weights a couple times and they don't want to lift because they're going to be too bulky,
Yeah.
right?
Right.
You're like, yeah, good luck with that one.
Yeah.
But
And
no, I agree.
my favorite line is, am I going to get muscle with testosterone? If you're going to lift weights, you get more muscle. If you don't lift
Yeah.
weights, you're still going to be the same.
Yeah, no, exactly. And it's amazing. Like, again, they also think of it as a weight loss, like
Hmm.
a lot of women, anyhow. And I'm
Hmm.
like, it's not an immediate weight loss, but
That's the
if
best
you
weight loss.
do build more
Hmm.
muscle, you will metabolize faster and you'll lose,
Absolutely.
fat, but it's not an automatic for sure.
No.
So PD5 inhibitors, nitric oxide, like again, kind of
Hmm.
comprehensively. So, do you prefer, like, how do you prefer to prescribe or recommend PD5 inhibitors to men? Is it depend on, what they're looking for? Do you do the low dose? What kind of treatment regimen do you do?
I mean, that's a good one. It depends on my career. When I first started, I was doing like a lot of low dose PD5 inhibitors. That was
Mm-hmm.
like my thing, especially depending on the severity of it, right? But
Mm-hmm.
now I'm thinking in this age of my career, I'd rather do PD5 inhibitors alone now. Usually I'm doing PD5 inhibitors with additives. So it could be oxytocin, which that's like
Mm.
85%, 90% of my prescriptions. And then, or going to be PT141, but I'm adding the peptides and oxytocin with, my PD5 inhibitors. I prefer that.
And where is there a particular? We don't probably do as much oxytocin.
Hmm.
But I probably need to consider that a little bit
Hmm.
more with it. We
Hmm.
do a lot of PT 141,
That's right.
which again, everyone loves,
Hmm.
and we can get into. But when you do oxytocin, I know that, it's the cuddle and the bonding. And
Hmm.
um, do men really love it when
Hmm.
they use it in
Yeah.
addition to? Okay.
Definitely libido. You get a little giddy too if you take it before, but it gets libido working. So,
Okay.
a lot of guys might complain like, "Oh, you need my libido dot." And PD5 is working, but I want my libido up a little bit, and that's why I think that the PD5 inhibitors with oxytocin is amazing because you get that extra kick to it. So,
All
it's
right. Yeah.
not
Yeah.
just
I
a
like
plumbing thing, it's not just blood flow. You still, guys can be a little mental too, not just the
Yeah.
women, but we're
Yeah.
so
I
mental
was
sometimes
gonna
too.
Yeah, sometimes I guess I didn't picture the men to like I was thinking of it more from a cuddle
Hmm.
standpoint, and
Hmm.
so that's where my mindset was with it mostly, and so
Hmm.
we've used more the combination. But
Hmm.
the PT 141, your
Hmm.
reaction from men?
I mean, it's pretty good. A lot of men like the PT-141 because they say about like the intensity of everything. It makes everything, improve. Like,
Mm-hmm.
especially for performance, like so many different areas, they feel like just, amplifies the experience. But I have not found any complaint on that. Even I say you get tan skin, a lot of places they want the tanning of the skin, right? That's like a
Mm-hmm.
plus for them. So I get a little tan skin, have a little fun with my wife, sure. And then that's like I think a plus for them. But I love the PT-141. But
Oh
the
yeah.
mix I do like too. But
Yeah.
oxytocin's that thing with them that just, all the areas, you get a little giddiness, you get a little bit of that, arousal pleasure, but you're also getting like, the PD5 inhibitors, so you get performance with that one. And PT-141, it's an amazing combination. I really do them alongside Viagra, unless I know you, or like you're doing it for a long
Yeah.
time, but I'm usually doing those as my
That
initiation.
combination. I'm gonna have to
Yeah.
try that one for sure. Because with the compounding, obviously you have so
Mm-hmm.
many different variations that you can do. And
Mm-hmm.
frequently we learn from our patients,
Mm-hmm.
because again, they're very progressive minded, right? They come
Mm-hmm.
in, they've researched some stuff
Mm-hmm.
and they'll come in and be asking about it. So we have to stay up on our game.
Yeah, definitely. And the women too, that's what's one aspect that really helped me up my game because, oxytocin for them was like, a couple years ago, that was amazing. Working with the women with that and even the PT-141, like, women take it, and in fact, it was made for women first, right? Like people
Hmm.
thought it was made for the men first. No, women are actually taking that first. But the benefits, there's some crossover with it. But
Hmm.
again, you still gotta know what's for the men and for the women. But that's an excellent one to like tap into because it's a little bit more
Yeah.
cuddly with oxytocin. It's like a whole mood thing too.
Yeah, I'm gonna have to try that. Have
You should
you
try some.
done Yeah, I'm gonna have to try it more. I know we had
I
way
try
back
some.
some lollipop thing that one of the
Mm.
pharmacies
Oh
was doing.
yeah, that was
And
years ago.
yeah, but now they're doing, do you do more of a spray with it or
Troches.
turkey? Okay.
Mm-hmm.
All right. Yeah.
Yeah.
I think that again, that is one way to combine so many
Mm.
different good
Yeah.
things. And there's a handful of different combinations of just the Viagra Cialis low dose with different
Mm-hmm.
things. That's wonderful. So
Yeah.
yeah, I think that more options. So definitely exosomes, the acoustic shockwave, all of it. What about the penis pump or vacuum erection device? Do you do that when you're regenerating?
Yes, I do. And I get, at first I didn't think I was gonna get the kind of response of my patients, but I had a lot of patients once they was going through the region, especially the older patients, they loved it, right?
Mm-hmm.
Because some of these guys had no activity for a long time. But once they start getting that, that's all the time. Once patients start getting motivated, you see the results. They become highly motivated. But I definitely like the penis pumps for that, for those reasons.
Mm-hmm.
Because especially my older patients, they tend to enjoy the performance and they get a lot more from it because they haven't had activity in years, right? Because it's like a muscle, right? If you don't use it much, you lose a lot of performance. Like, you just can't come to your doctor after 2 years and not have performance and then you perform again. Like, no, you have to go through a process to get back. And the penis pump does a good job of that.
Yeah, no, it does. Do you ever use Trimix when you're regenerating if they have severe, when you're in the process? Like somebody, because I have a bunch of men that have come
Mm-hmm.
in, haven't had sex in a while, like the one that you talked about.
Mm-hmm.
And then as we're regenerating, you want to get them active. So I've used a lot of
Mm-hmm.
Trimix just in the bridge,
Mm-hmm.
it works well. Do you use that a little bit too?
Yeah, I have before. And some of the nitrates too, because, especially if they had no activity. Yes, I definitely have used that,
Yeah.
especially while they're trying to, especially the guys been inactive for a long time.
What is up and new? What have we haven't talked about that I need to know about that you're doing? Just like this oxytocin trick. I need to know all the
Oxytocin,
tricks.
and
What
then
other, yeah.
and the other one I'm looking to was RF for men. I was looking
What
to radio frequency for men as well
and
too.
how are you using that? Tell me about that.
So there's some RF devices out there now that are doing ED and ED trials, right?
Okay.
And usually at the base of the penis, but they're going in enough depth to hit the corpus cavernosum, right? With some
Hmm.
radio frequency, little heat. But with that, it's like kind of think of the shockwave, like force the body to heal and repair itself. But I was
Mm-hmm.
working on a protocol with the Shockwave, with a PRP or Exosomes as like the next like cutting edge treatment, because there's a few things out there with shockwaves are prevalent, and ED and erectile dysfunction is become with PRP, and then you have exosomes, but I haven't seen many clinics was doing that. But I came in a protocol with my clinic, one of my friends in his office, but they're definitely seeing great results with RF. So I think that's going to be
Okay.
another one. And then I think also with the Shockwave devices, it's going to be some new differences, because some of them you get like you get a little radio frequency, some of them
Mm-hmm.
more in depth. But I definitely started looking more into like, because I had a Shockwave,
Okay.
it's a different Shockwave that gave more depth, but it's actually comfortable, and I've seen great results with that one as well.
You're
Right.
talking about the focused, right?
That's
Focus
right.
versus radio.
Oh
Okay.
yeah.
Yeah.
I think
Yeah.
focus is something that I look heavier into.
Yeah. I actually am getting ready to we were opening up this office. So we weren't rushing to do it because I wasn't going to
Mm-hmm.
purchase it prior to being able to put it in operation. So now we're ready because the office is open. We just didn't have room before. But I'm interested in that too.
Mm-hmm.
And you know what's interesting as well,
Mm-hmm.
and I'll keep you up to date on it as I implement it, but
Mm-hmm.
hyperbaric for
Mm-hmm.
ED is supposedly there's some really good studies on that.
See that?
And in the first location, I'm going to turn that into a longevity where I have some um, like extended services my patients would want that I
Mm-hmm.
don't have the room for here, like DEXA scanning,
Mm-hmm. Right. That's it.
VO2 max,
Love.
and I'm doing a brain room, but we're doing a hyperbaric over there, red light bed,
Mm-hmm.
that kind of stuff. We already have an IV therapy lounge, but
Mm-hmm.
I saw that there's, again, good studies on the ED. So I'm kind of curious because
Mm-hmm.
what organ wouldn't it help when you get more
Absolutely.
oxygen to it, right?
I
So,
absolutely. I should do a lot of hyperbaric trainings for brain injury in the past, but I definitely like that for ED, because even like, people get benefit from cycling, working out, all that nitrous oxide, oxygen going, flow. But I can see the aspect, especially after like a treatment, a hyperbaric
mhm.
oxygen, right? Because definitely with wound healing,
Yeah,
you see?
yes.
Yeah.
Yeah. I mean, it's with like
Mm-hmm.
brain, Alzheimer's,
Mm-hmm.
anything like neurologic
Mm-hmm.
neuropathies. Like the studies are like they have done so
Mm-hmm.
many studies on it. And so I just want to see it in practice, though, too. I already want to do it myself
Mm-hmm.
just for all the health benefits of it. But I want to see how the ED patients do as well, how those men do. I
That's going to be
suspect
great.
there's going to be some. I'll probably do that before I do the RF.
Yeah, I need to
I'll
come to
do
your
the
office.
focus though.
Yeah, I
Yeah,
need to
no,
come to
you
your
do.
office. The focus,
Yes.
I'm telling you, like I think focus something that, because it's more expensive, right? The focus, but but I think quality, and even like pain wise, it's amazing, right? But I think
Yeah.
focus is something that should be locked into a little bit more with this industry.
Yeah. Well, I'm getting ready to look into it. I was having trouble
Hmm.
um finding one. And so then I
Hmm.
was in touch with Gainswave and Mark, and I'm gonna do that
Yeah,
focused device with
yeah,
them. And I'm excited about that one. I'll probably do that before I would
yeah.
do the radio
I,
frequency.
I agree.
And I have radio frequency
Mm,
here,
I know.
but I think that I feel uncomfortable with that at the moment. But I do radio frequency in the vaginal
I
canal,
know.
so
It
I don't
was
know why I would be
it was new.
uncomfortable.
It's new. It just got into like the market, really. Like it's not very common. Like Shockwave's been around for a while now, right? So be comfortable with Shockwave. But I think for your practice, by you doing the, focus, that's an easy additive, right? Because you're already doing Shockwave already. It's nothing much to
Yes.
explain, versus like bring the laser in and or adding one of your lasers. It's like a whole different like process, right? That you have to add and
Yes.
explain to the patient. So it's still relatively new. I like the fact that it's starting, but I think in the future it's gonna be a lot more of that out there. But you're right,
Yeah.
cost, and then also it's a new thing to add to the office, because you're doing something already. To put it in
Hmm.
focus is nothing different, really. It's just a
No, it's an
different kind of
upgrade.
process. That's it, really.
Yeah, an upgrade. In
Yeah.
fact, so I talked
Mhm.
with, again, Gainswave about that because they're calling that focus. I was having trouble finding a focus device though.
Mhm.
I was and right at that time, I saw them starting to promote the OmniWave, which was the
Mhm.
focused aspect of it. But I have talked to him, like, I think I'm just going to call mine a Gainswave 2.0
Mhm.
because otherwise I think it gets
Wow.
confusing,
Wow.
yeah,
Wow. You know,
My
I told
patients
Mark
don't.
to
Yeah.
upgrade that so many times. I'm like, Mark,
Yeah.
2.0. Like iPhone makes a new
2.0.
iPhone every year,
Yeah.
excuse me. Like you can make this Gauge Wave 2.0, but I was talking about focus for a long time because I got a focus treatment on my knee. And I'm trying to tell you, I didn't feel pain and I was walking. Like focus is amazing. But for the
Yeah.
ED point,
Yeah.
much better, much more penetration, less painful. But I was telling Mark for a long time, update it to 2.0.
2.0. Well,
Yeah.
I did. I messaged him and said, I'm a little confused because the OmniWave will confuse my patients
Mm-hmm.
because we've been of the Gainswave like mentality. And so they'll get confused by that. And I think it was because of the musculoskeletal, which again, I think that is hugely beneficial,
It
but it
is.
won't be the focus of my practice. But of course, we
No.
can add that on now if somebody has any kind of muscular
Mm-hmm.
pain. But I
Yeah.
think Gainswave 2.0 sounds like a more clean cut version of it for me. My patients will understand that one
Yeah, it
for
won't be hard
sure.
to explain, right? It's
Yeah.
self-explanatory.
Yeah. And you know what? My thoughts, the more that I think about that RF,
Mm-hmm.
um, because again, I'm really obviously into
Mm-hmm.
newer treatments and progressing if it all
Mm-hmm.
makes sense. But one of the things with aesthetics, and I think now this
Mm-hmm.
might be where this is coming from, there's very limited technologies and unlimited brand names, right? So you
Unlimited.
only have so many technologies, and now they're going to try and make RF good for ED. But I
Mm-hmm.
think I would stick with the focused instead because
Mm-hmm.
I think, and then we'll see what happens with the science after. We'll see what they're getting as far as effects.
I
But
think you're right, because this industry's always been full of, especially lasers, so many devices out there, but it's
hmm
like, but it's not so many things that have been for ED. Now I'm glad there's more things added to it, but you still need your core, like Shockwave, your
yeah,
peptides, PD5s, your basics too. Like I think Shockwave
yeah,
over laser anytime because there's studies behind it and that's proven, right? Especially for mild,
yes,
proven in studies already. I mean, randomized controlled trials, you can't even argue that anymore.
yeah,
So you go on something
yeah,
versus new, which is like very new to something that's already proven itself already, and we done thousands of procedures. I have trained
yeah.
thousands. I'm a believer in Shockwave. I'm trying to buy my own Shockwave for my home. Like Shockwave is amazing, right?
Yeah, no, it is. And
Mm-hmm.
when it comes to the aesthetics, I think this is again one of
Mm-hmm.
those times where there's limited, again, technology. So RF is a technology, but there's 20 brand names for it, right? Will
Mm-hmm.
you run out of
Mm-hmm.
things that you can sell if you're like a
Mm-hmm.
laser company and you have one RF device?
Mm-hmm.
So you've got to kind of develop another
Mm-hmm.
RF device that's maybe being used for something else. And
But you
then
know what? But you know why they want RF for men though for the ED because I'm gonna tell you, per their numbers, they say like almost every decade of life, like 40%, 50% of the men in their 50s, and 60% of the men in their 60s. Like that's millions of people.
yes,
Like they're highly motivated to cover that many men that suffer from this, and think about all the men that are failing those pills too. Like their
yes.
eyes are open.
Yeah, I know, but I think that like we have good treatments that we're
Hmm.
progressing, especially with the 2.0 or with
I know.
focused. And we have so many other
Hmm.
things. I'm going to wait and see what that science is
I
because,
agree.
yeah, the laser, like our Peyronie machine, has an Nd:YAG and an erbium, and they were trying to get us to do the Nd:YAG
Hmm.
for ED way
Hmm.
back. Oh, this works for ED, but to me, it was like the acoustic shockwave did, and so I wasn't going to implement
Shockwave is
it.
less
Never did.
invasive than the
Yes.
RF because the needles got to go in, right? There's
Yeah.
like a head to it, so the needles kind of go into the penis. So you're getting, penetrated. So it's like a kit piece that you got to dispose because they're going into the person, like these small little needles. Versus
Yeah.
Shockwave's not doing that. That's only on the surface topically. So
Yes.
how it's going to
Yeah.
work? So Shockwave, you could do so many treatments with that. I was like working with the laser, but I was like limited to like maybe one. Like you can't do 12 treatments like that easy because that's just my opinion is way more invasive. It needs
Yeah. Well,
more. It needs more looking into it because it's more invasive than the Shockwave, which
Yeah. Yeah. No, well, and even the laser, like the Nd:YAG was just a simple
hmm
heating. And so it would have been easy to do. But
hmm
to me, I did it on a few patients because it wasn't invasive and I didn't see anything. And I thought, well, I
wow.
know acoustic shockwave does, and I know my patients are getting good results. So I did not progress that. I will say that we
hmm
do Morpheus V, which is our radio frequency for the vaginal canal. So we actually will do microneedling inside
hmm
there. And it's interesting because when I went
hmm
to train on it, I thought, I mean, I don't even like to have RF on the face because
hmm
it's super painful. So I thought, I don't know how this is going to happen. But the women do well with it. We do a topical numbing and then we'll do the RF microneedling and they do really well. So I think the vaginal canal, that my theory is the
Yeah.
vaginal canal is more blunt forces and not used to sharp.
hmm
And so I don't think they have as much sensitivity to
I think
that
you're
sharp.
right, and I think
Yes.
you like really are like cutting edge on the aesthetics, vaginal aesthetics. And I think RF, for that procedure, I've seen in my office, like I told you, like 6 years ago, I had a Mona Lisa in my office, and the patients was
Mhm.
getting, I had 12 women lined up that day for the Mona Lisa, and he was all happy. Like
Yeah.
30 days later, everyone was happy with the results. I'm hearing the feedback, and I'm hearing like the testimonials, and it was great. So, again, that's where you treat the men like a certain way, the women a certain way, like Shockwave, RF for women.
Mhm.
I think where the signs come in, and even talk about radio frequency, you're right. Like, I don't have one in my office. I've used one a few times, but I'm not all the way convinced. Shockwave, I have several Shockwaves, and that's for a
Mhm.
good reason. But I do think, like, so many labiaplasties, which I don't even see anymore like I used to, but I see a lot of women doing RF now and
Yeah.
getting great results with it.
You saw some of our pictures of the before and
hmm
after vaginas, right?
Night and
That
day,
was yeah, yeah, night and day.
night and day.
That's the 4V, so that's our Photono machine. And
Yeah.
again, you can do a 4D on the face, which was a
hmm
non-surgical facelift, and it has 4 laser treatments in one. So
hmm
you go inside the mouth and on the outside for a couple
hmm
levels and then a resurfacing. And then they're like, well, you can do it on the vaginal canal. And again, we did our first one and it was literally in 1 hour with no pain and no downtime, night and day.
That's right.
So that was all I needed to know that, like, again, women with no, we could tighten up the external, which
That's right.
also changes with time. And then recently there was this
hmm
thing about Ozempic vulva
I
was
heard about
trending
that.
on social media.
What do you think
Yes.
about that? You think it's real?
Yeah. I think that as we get older, for as many
hmm
women as we see, and as
hmm
many women as I have seen in the ER, I think it's normal anyhow that you have. I heard one like physician influencer talking about how the labia disappear as we get older. That is not what I see. I see more
No,
laxity. So,
right.
so I think that, yeah, it's probably not, you're not going to lose that much fat, but I think it's going to happen anyhow.
Yeah, you'll get some
And
atrophy, especially with like menopause, but that's
yeah,
expected, right?
yeah, and you're gonna get like that where it's more laxed, but that is so easy to correct with this
Yeah.
laser. And then obviously you can inject filler there if
hmm
you couldn't, but I think the lasers are great at just
I
tightening all
saw
that
your
up.
before and afters too with I think she had 4 kids, one of them, and came back aesthetically
Yeah.
well too. And
6. Yeah.
yeah,
That one had 6 kids and it was
that's
and
right.
again, her vagina didn't look like anything,
hmm
it looked like a normal,
hmm
something I would have
And the
seen in the
hormones
ER
help
all
so
the
much for
time.
that too. You hear the stories
Yeah.
because back in the days you get the what's the estrace down there for the women,
Mhm.
and you hear like,
Yeah.
okay, a lot of the it's becoming more profound down there again, right? And then instead of all that shrinking atrophy, but we know that with menopause that shrinks, right, as expected,
Mhm. Yeah.
because
Well,
they
the
get
one
painful
lady
sex, right? Everything started to atrophy, right?
yeah, one lady was cute. Well, it wasn't cute. She came in, she's like, "It's like a desert down there. We gotta fix this." Like, she was
Yeah,
older. So we're fixing all of it.
yeah,
But it doesn't have to be any different for men or for women. They just
hmm
need to know that there's regenerative treatments out there so
yeah,
we can communicate with that tissue, tell it it's injured, get better blood flow, sensitivity, and
hmm
again, as long as there's not a neurologic component,
hmm
then there's no reason why we can't regenerate all the way
yeah,
back. It just depends on how much they're willing to
hmm
commit to that, right?
yeah. Neurological component is so difficult too, which you're right. Like I've seen, which can be done, but just so difficult. Those kind of patients,
The
right?
post
I've seen that.
prostate, sir.
Yeah, I see. I did well with some diabetic neuropathy patients. right?
Mm-hmm.
They actually came back, and and those patients did not do well with Cialis. It did not even work. They took 1, 2, nothing's going to work for that one. But
Mm-hmm.
I've seen people come back, but neuro cases are tough,
Yeah,
and
no, they
there's
are
very
tough.
few. And you might get a lot more. Get the prostate patients, right? Those are the ones you see a lot of
Mm-hmm.
those neuropathic issues from the nerve damage. Even with nerve sparing, people think it's like fine. Like, no, I've seen nerve damage still with nerve sparing. Lots
No,
of it.
absolutely. So you
Yeah.
have to and I really just have to wait, and you have to wait, obviously, and
Hmm.
to see if they respond at all,
Yeah.
because it's still worth trying. But again, hitting it with exosomes, something a little stronger, is obviously a game
Yeah. Right.
changer when it comes to that.
Yeah.
But yeah,
I think you're at a good point now what you're saying, because like I remember 2 years ago, like I wasn't even hearing these kind of talk about women, but I do think that both sexes have options, right? So it's been definitely men heavy for a long time, but I do
mm-hmm.
think the women now are neck and neck with options now to get things going again and to get themselves, improve their sexual performance and everything. Because before it was so male
Yes,
dominated, but I do think, because when I first started, I was getting 90% men and 10% women. I think about 50-50 now in the
yeah,
office,
yeah,
and especially with
yeah,
hormones, right?
yeah. Well, it's interesting though, because
Mm-hmm.
that's our experience. And
Mm-hmm.
so I will say, when I first opened my office, that the two things that took off were women and testosterone. So that
Mm-hmm.
was a huge missing piece. So saw a ton of it, and sexual wellness, period.
Mm-hmm.
But men, a lot more men for sexual wellness.
Mm-hmm.
And they would come in ready to move forward, do all the treatments. And the women,
Mm-hmm.
you had to almost convince.
Mm-hmm.
Now, that's where I would say the changes for us. The women
Mm-hmm.
are ready. And
Yeah.
there's a lot more of the sexual wellness patient that's women,
Mm-hmm.
but we already see a lot of women for the hormones.
Mm-hmm.
But I will say that they're probably far off from it. And I think that's our practice, because
Mm-hmm.
women are more open now, and they're
You're
like
right.
looking for solutions, and they're hearing about it.
Mm-hmm.
But I guarantee we're nowhere close to, I don't even, do you think we're even close with the hormones? I know they're talking about it a lot,
Mm-hmm.
but do you think that that traditional model is close to actually prescribing them the right way in the office?
We need a few more different options for women, because men have been at the forefront for the longest, especially the hormone standpoint. I'm talking to some companies about some new options for women, which they're coming out like they're going to have oral testosterone for women, but more and more things came out. I think now with this black box removal for the hormones, that's going to change everything now. I do
Right.
expect the women to have a lot more options, but you're right.
Right.
It's not equal grounds. No options.
Yeah.
The women, sure, but equal grounds, no. Men is a landslide, because we had everything at us for the longest for hormones, especially testosterone, right? But
Yeah.
but now I
Yeah.
do think, because I know what to do. If I have a wife, she need to get fixed, I send it to you. She'll come back, and I feel like she'll be 15, 20 years younger, right?
Yeah.
Performing
A new
versus 20 years
vagina in a
ago. That's
couple
right.
a new vagina in a couple hours is what we say.
That's right.
We do that a couple times, and you're all set to go. I just would say that I think that
Yeah.
it's like we took the black box warning off, and it's not going to change. Like, we may get more women that aren't afraid, but I feel like now that it's been removed, but I think most of the time they end up in front of us because they're already progressive minded, men or
Hmm.
women.
That's right.
And so they probably haven't been waiting for anybody to give them approval. They
Hmm.
just had to find the right doc that thinks outside of the box, right? And we
Hmm.
should be able to direct,
Yeah.
what we research and implement into practice. But anyhow, we'll see about the sexual wellness. I just think that they're going to go to their doctor assuming that suddenly after 20 years, the doctor is going to prescribe things all the right way. And so
Hmm.
I want to see what happens with the practice, and what women, because now they know more about it, but whether they get the right options in the primary or in
No,
traditional, I
that's the
don't
problem
know.
with the primary. Like, well, you practicing now, they'll be looking at you in 30 years from now saying like how cutting it. It's myself too. Like, we were so far into, like, ahead of their time. But no,
Hmm.
it's going, like, even to do, I think the primary care to be on board with testosterone, it's going to take them at least 20 years. Like, you need a whole generation of doctors to understand this, to do this properly. And they're
Yeah,
still going to probably give them testosterone only, right? They're not going to, they need a lot more time, I think, before they, even
yeah.
though the rules are going to change. like 20, 30 more years for sure.
Yeah, well, they won't give good guidelines right away, but
Mm-mm.
yeah, but at least it's out there. At least they're talking about it. So I need to stop being so negative. They just, at
No,
least
you're
they're
not.
talking about
I
it.
think you're realistic. I think the men,
Yeah.
I've seen the men all the time get underdosed, and women get nothing, right?
Yes.
So, and
Yeah.
that's in the primary care land. For me and you, like it's totally different. My women are, I'm empowering them, right? But a lot of
Mm-hmm.
women I've seen in primary care, they get nothing, right?
Yeah.
And then it's like, Dr. Haywood, I heard about you. From who? A friend. She told me you gave her this and go through. You know this couple? Yeah, Dr. Haywood. Yes. Like if I go to
Right.
Boca, West Palm Beach, in these areas, like Dr. Haywood, I'm like, oh, okay, I'm walking. But again, it was just like more of a word of mouth thing because their friend told them
Yeah.
something, their girlfriend told them something, and then it's
Yeah.
like, okay, they come see me. You go to
Yeah.
primary care, they get dismissed. Or they even go seem like you want to take roids, or like, wow, like completely like judged, right? But women in a primary care standpoint, they're not getting power with this. But you know,
No.
it's
No.
funny. I see so many doctors now. I see over 100 doctors now, MDs. I got men and
Oh,
women seeing
yeah.
me now,
Yeah.
right? And
That's
it's funny
actually
is
a
that
good point.
yeah, the
Yeah.
MD sons come to see me. I'm like, okay, and the women are coming, and the women are especially the MDs because they can empower themselves and they can read and they can do research into what's what.
Mm-hmm.
So,
Yeah, no, absolutely. That actually is a great point. Is that I have
hmm
a lot of referrals locally from the physicians and I worked ER and I worked all over town, so I've known them.
hmm
Um, but only from the ER standpoint, and
hmm
slowly over time, more and more and more have referred or came, but also refer patients, but their wives.
hmm
Also a lot of them coming to us. So yeah, you're right. I didn't think
yeah,
about
a
that.
lot more MDs. If you talk
Which is
about
a compliment.
peptides, I'm getting calls from colleagues, plastic surgery. I'm getting my best friend's a hand surgeon, orthopedics. He's texting me, like so. A lot more things coming out, and then the hormone stuff is able to, really coming out more and more. But I'm seeing a lot more of it. But I think
Yes.
you're right. Women are now, I feel like, more comfortable about it. But you're right. At first, you're convinced, and then being a male physician, how do I bring up sexual performance without women getting like, oh, he's getting fresh? But I always try to do it in a respectful manner. I talk about as the marriage standpoint, right? And usually
Mm-hmm.
not 10 out of 10, nothing happened to me yet. I never even got yelled about it. But I bring it very respectful. But it's not easy though. Talk about these things because before it was
No.
taboo. You brought up sex, dude. They're married. She got 4 kids. They're having sex, right?
Yeah.
It's just if you're gonna break it or not. But again, if she's not having a libido anymore, then just bring it up. You bring lost libido. It should
Yeah.
be a question I think. But you know what? How many primary cares will even ask that question? What do you think?
No. Oh, very. Like probably zero. Like honestly. Yeah.
ER doctors,
N-
patient with suicidality, you bring it
No,
up?
no,
No.
no. Nobody. In fact, though, there
Mm-mm.
was a study that recently it said that 50%, less than 50% of the GYNs would discuss sex. I don't know where they did that
Wow.
study. I don't know where they did
Wow.
that study because I would say it's closer to 0%.
Uh,
Because actually, we have an intake and it asks them, have you
mhm.
brought up these problems with your like primary
Wow.
doctor or your GYN? And every single one of them says zero. Like, yes, they brought them up, no solutions offered. Those are the two questions. So, yeah, I
Mhm.
don't, I would have to look at who
That's
reported that study. But
That's
yeah.
amazing you said that because lately, like the last couple, I don't know, the last year or two, I've been getting some mixed GYN patients. Like, they're coming in not on testosterone, they're on estradiol orals and progesterone, like, but just the super old school. I'm like, where's the young GYNs giving out hormones the right way? But you're right. I'm seeing a lot of times they're leaving GYNs to come see people like me and you over
Mm-hmm.
and over again because they're hearing about testosterone. Or you know what it is? Their husbands, right? They bring
Mm-hmm.
them right on in. That's like the number one thing for me all the time. But OB been hit or miss with me lately. I'm not seeing them treat women like how me and you would treat them.
Oh no. And I
Yeah.
don't like you and I both say zero. Maybe it's 1%, but it is definitely not under 50, which could be 49. There's no way that that's happening.
Wow.
But yeah, but I think, well, we'll definitely get on again. I think that the comprehensive approach is necessary.
Mm-hmm.
And once I get the focused,
Mm-hmm.
then we'll
I
get
love
back
to
on and
come.
talk about that. Yes. And then you need to come and visit the office and
Yeah.
and check that out. So, but yes, no, I thank you for sharing everything today. But again, Dr. Haywood has a active practice in Miami,
Hmm.
and he's been doing this since Acoustic Shockwave came to the U.S.
That's right.
And so that was an innovation that we very much needed.
Hmm.
But you're doing everything. You're doing the hormones, P shot, PRP injections, the acoustic shockwave, the peptides, the
Hmm.
exosomes, like again, everything. And so
Hmm.
if you want sexual function back, that's the type of doctor, Dr. Haywood's the type of doctor you need to see, for sure. So you
Thanks,
want it
Deborah.
all approach. You are welcome. I'm so glad we met. And then we are going to
Hmm.
get back on and talk about focused after I get it here. Okay.
Okay, perfect. I'll come Tennessee. It's warmer now,
Yeah.
so I could make it from Miami and Tennessee. So
Yeah. Yeah. Well, you don't want to come right this second. It's way too cold.
I
But
know.
yes.
I know when spring starts after March, right? Yeah, I know.
Yes. Yeah. And the lakes are beautiful around here, all
Nice
kinds
and
of
green.
boating. Yeah. No sharks. That's
Yeah,
important. Yeah.
yeah. No, not
But
that.
all right. Well, thank you so much for joining me today. And again, thank you for watching and listening. And if you want to ask any questions, please just drop some comments. And let's open up a conversation in the comments. And remember, we are willing to deep dive into anything sexual wellness or wellness. And thank you, Dr. Haywood, for being with me today. It's our practice because
Hmm.
women are more